In 1968, there were no services in El Paso offered to parents of children with type 1 diabetes. The mother of a type 1 child partnered with an endocrinologist to offer resources and information to other families with type 1 children. We're here to provide information to anyone who needs answers about diabetes. We help people learn to prevent or manage their diabetes, and we help them identify local resources. We want to use education and empowerment to prevent diabetes and its complications. To do this, we need more robust children's services, and we need additional resources for media and outreach campaigns. We work with a larger population of older adults, but we'd like to focus more on children's health through education and exercise programs. This would decrease the number of children being diagnosed with type 2 diabetes. We are local and independent, and we're able to respond quickly to the needs of our El Paso community. Our staff consists of nurses, educators, kinesiologists, and chefs who help us meet the different requests from the community related to diabetes care. Our employees are dedicated to helping anyone who needs our help. That means we make programs that suit anyone's needs. So if a person might learn better in a one-on-one environment, one of our staff members will be making sure that's what they get. And if someone is too ill to travel to our office, an educator will provide a home visit for the client. What makes our organization successful are the programs we create for our community, such as our healthy cooking classes or our Move exercise programs, which promote healthy eating and staying active. We're constantly assessing our programs to make sure we're up to date with what is happening around us. Community relevance is crucial while we're customizing our programs. And within our organization, regular staff meetings help us keep satisfied employees and ensure our new ideas are heard. El Paso Diabetes Association is independent and local. We've been working in the community for more than 45 years, but we're often mistaken for a chapter of a state or national organization, which has very different goals. We're here to provide people with education to learn about their diabetes and promote prevention rather than research. Also, the reach of our program is not often known within our own community, so making our community aware of what we do is always our first step. For more than 45 years, we've been working to grow in the community, but we weren't presented with the opportunity to purchase our own home until 2013. The purchase of our own home is a huge accomplishment because we can now offer our programs out of our office, which is centralized within the city, instead of clients driving to different locations. Reaching more than 15,000 El Paso County residents every year is also a great achievement. We are reaching a large part of our community, but working harder every year to increase that number is also very rewarding. A challenge that comes with being a nonprofit organization is long-term funding. This becomes a vulnerability when our programs and the community are depending on it. In the past, we've had programs postponed because of lack of funding or delays in grant opportunities. More resources would help us serve more El Paso County residents. It would also let us start a foundation for those who can't afford supplies or medications, or for those who are disabled due to diabetes. We could also have a massive and sustained outreach initiative to ensure everyone is aware of diabetes and its complications. We would even partner with schools to make sure our efforts are reaching the younger generation and helping them live healthy lives. We'd like to better serve people who are pre-diabetic or at high risk for diabetes. We already work on prevention initiatives to spread awareness, but want to get people with pre-diabetes to participate in our programs. Usually, people aren't aware that it's in their family history. Others might lapse on checking their glucose levels because they feel fine. We'd like to serve and educate the entire community so they have an opportunity to change their lifestyle before they've been diagnosed.